Today I want to teach you something simple but powerful. There are 3 markers you should keep an eye on if you want to reverse insulin resistance, prevent or reverse prediabetes, or keep type 2 diabetes under control without medications. My goal is for you to understand your lab results, to know what they measure and what they mean, and how you can use that information to make better choices and track how those changes are working in your body. Of course, the ideal is to catch things early before diabetes or even pre-diabetes show up. But if you're there, don't panic, don't worry, because yes, you can bring those numbers back to normal. So what should you be looking at? Well, when we talk about sugar metabolism, and by sugar, I mean glucose in the blood. So when I say that, I'm going to be referring to glucose in the blood. There are 3 main labs I want you to know. One is the fasting glucose, and that is going to show you how your blood sugar is doing at that specific time, that specific moment. 2 is the A1C. It's going to give you an average of your glucose over the last 3 months. And then 3 is the insulin. It's going to tell you basically how hard your pancreas is working behind the scenes to keep your blood sugar normal. Here's something most people don't realize. So usually people don't notice any symptoms until they get a diagnosis of diabetes or prediabetes. And it's after they start improving their blood sugar and feel more energy, clearer mind, less cravings, that they realize, wow, I really wasn't feeling good before. But in the moment, it's easy to miss it. And that's why I like to track these 3 markers, because years before your fasting glucose shows up as high, your body has already gone through insulin resistance and then prediabetes and finally diabetes without you even knowing it. Your body's beautifully designed. It works hard to keep things in balance. So when it notices the blood sugar creeping up, it responds by making more insulin. And that's why your labs might look normal for years until one day the A1C goes up. And by then your pancreas has been working overtime for a long time. So knowing this helps you read your labs with new eyes. So here's your 1% step for this week. Ask your doctor to include these 3 markers in your next lab work. Remember, fasting glucose, A1C, and insulin. Who should be doing this? I would say anyone, noticing that they're gaining weight, feeling more thirsty or more hungry lately, noticing more skin tags on the neck or on the body. I'm sorry, my dog is there. Or just wanting to check in on their glucose metabolism and optimize it. With simple steps and the right mindset, you can take control back of your health, 1% at a time.